Pretty much everybody has one. And where do you go whenever your pet is sick or something's wrong, or even if you just need a normal annual doctor's checkup? You're gonna go to the vet. And at vets, they have vet techs, which are pretty much the nurses of the animals. So first we're gonna talk about what a vet tech does at a normal annual visit. What they do is they go in, get the client, bring them in with their pet and check their vitals, get a history, and go over any vaccines that they may or may not need. Then they're gonna take some blood. Most of the time, whenever they take blood, they're going to get it from either the leg or the jugular vein, depending on how wiggly they are, what the size is, or where they can find the best vein. When they're checking the vitals, they're going to first check the gums to see if they're pink or if they're white. If they're white, not a good sign. Their normal pulse for a dog is going to be 80 to 140, and for a cat, it's going to be 160 to 200. Normal respiratory rate for a dog is going to be 10 to 40, and for a cat, it's going to be 20 to 40. Normal temperature is going to be 100.5 to 102.5 in either cat or dog. And this is from Dr. Marty Becker from DVM. Now, depending on if it's just an annual or if they're actually in there for a serious situation, they're going to assess, the vet tech is going to assess what exactly is going on with the pet. If it's something serious that needs surgery, that's a completely different scenario. So after checking the vitals, we're going to figure out how serious the situation is, such as if an animal ate 10 socks, if an animal has an open wound, or if it's something that's just like a UTI. Something with the UTI, they can check that with a urinalysis and go ahead and get some medicine. And the vet tech will actually dose the medication, fill that prescription, and get it to the client and go over that information, which we'll talk about a little bit later. If the pet actually needs surgery, what they'll do is they'll actually take them into a surgery suite and get them anesthetized. The vet tech's job is to actually be the monitor of the pet while they're under anesthesia. So while they're monitoring under anesthesia, they're going to be checking their vitals, the SpO2 levels, and blood pressure, and be checking the gum color as well, because like I said before, if the gums get pale, it's not a good sign, and that means they might be having blood loss somewhere. So, normal SpO2 levels in a dog that's under anesthesia is going to be 95 to 100, and normal blood pressure is going to be 120 over 80. If it ever goes less than that, it's up to the vet tech to figure out what's going on, because the actual doctor is probably inside the animal trying to fix what the actual issue is. Also, one thing the vet techs have to keep in mind is that the temperature of an animal is actually going to be getting a lot lower when they're anesthetized. So they have to keep up with the heating pads. A lot of times they'll have a heating square. They can have heated towels, a heated water bottle, that sort of thing, and they have to monitor and make sure that the pet actually doesn't get too hot. So now to the most important part. Once the vet tech has actually monitored the patient is awake from anesthesia, and the client is coming to pick up, it is up to the vet tech to go to the client and go over all information that the client might need to know. If it's just an annual visit and the pet didn't actually have any surgery or dental done like that, they will just go over any medications they might need, or let them know that there might be a reaction to the vaccines to come back in for a checkup, or when they might be due for more. If the pet did receive surgery and was under anesthesia and is being sent home with any sort of medication or needs any aftercare, it is up to the vet tech to let them know when their pet might need physical therapy, maybe due to an ACL surgery or that sort. It's also up to them to let them know when to stop the medications, how much to give them, and they will show them how to give them as well. Well, thank you for listening to my speech about what it takes to be a vet tech. Thank you guys for coming.
Yay!
Thanks, Jace. Thanks.